the #1 health program for over 30 years. Life, liberty, and the pursuit of healthiness with Dr. Dean Edell.
Hi, everybody. Dr. Dean Edell here. Welcome to the program once again. And before we launch into it, a preface. This is probably going to be the hardest show I've ever done in my life. Kind of reminds me of a feeling I used to have going into an examining room and telling a patient they have some terrible illness. This is nothing of that magnitude at all. But I feel uncomfortable. I'm being honest with you. I've made an extremely difficult decision, as all major life decisions are, and I guess I'll get right to it and say it. I am retiring. And after 5,000 shows, Heather and I have added up here, and 15,000 medical minutes and a lot of high points, some low ones, I'm throwing in the towel. And believe me, like all these kinds of decisions, it comes with a deep, deep mix of emotions and feelings. And that's, one of my lectures, that you can't make decisions in life without having mixed emotions. And I learned that late in life, to tell you the truth. I always thought if you have a feeling or an emotion, you make a decision based on it, but your brain can compute these things differently. Personally, I'm excited, personally, on one side of it. I've got 20 kids and grandkids that I just don't get the chance to interact with the way I would like to and the way I imagined a grandfather would. They've sacrificed. You do anything heavy in life, there's a sacrifice. That sacrifice is usually made by a family, because when we're in mid-career, we just think we can get away with it all. It's just like the conundrum that faces women today, trying to raise kids and work. I have a lot of interests. I have a lifestyle I love, and so I'm excited about all that. But I must say, there's a part of me that is very sad and upset. I'll tell you some secrets here. I called my boss, who sits at the head of, the most major force in radio today. This is a company that brings you, Rush Limbaugh and Glenn Beck and me, and brought you Dr. Laura, and big time. And we got sniffly on the phone when I told her I was going to retire. I don't think that happens a lot in business, and I've worked for great people. But I feel, I still feel responsible. That's the doctor in me. I came from a different place. I entered this business 30 years ago, and there was a lot of resentment. I wasn't accepted because I came through the side door. I didn't pay my dues by working in teeny tiny markets and working my way up. I just walked through the side door because I was a doctor and was in the right place at the right time. Being a doctor, I come from a serious place. And it's affected my attitude about media and what I do here, but I can't shake that responsibility thing. And I suppose one of the hardest things in doing this show was removing myself emotionally from you. I was never good at that in clinical medicine. I'm going to tell you a little bit of my life story a little bit later in this monologue to explain why I left medicine. A lot of you know that. I didn't do well emotionally. I remember doing surgery on a woman that I did a great operation. I did. Perfect. I have good hands. I'm coordinated. I was a good surgeon. But it went south. She didn't do very well. All night. Up all night, every night, worrying about her, dreading the moment she'd come into the office for the follow-up. And I just said, maybe I'm not cut out for this. I always loved the information about medicine. And, I've talked about my medical school experiences, and they were horrible. And dealing with patients is a whole different thing. But I worry about callers, too. Now, Heather really bears the brunt of that. This is kind of neat and clean. I can give you my best and answer the question as best as I can. I hit a button and away you go. But even that, I wonder sometimes, and I've said to you many times on the air, hey, call me, let me know what happens. I can't break out of that. And you can imagine Heather's job. Can you imagine, we can't put all of you on the air. She hears incredible stories. Some really, really sad stories, some uplifting stories, and she often has to make the decision of what to pass on to me. And I've watched over the years how she's had to learn, to take a step back. You can't get emotionally involved with your patients and be an effective doctor, but you have to appear caring. The question is, I do care. I worry most about you getting the right information, and we have been a lonely voice here. And to my knowledge, still, we are about the only place you can go reliably, in commercial radio anyway, and get an opinion, based as well as we can on fact and objectivity as opposed to emotion. And that is always a debate. That's what we deal with here. And you are entitled to have your own opinion about things, but you're not entitled to have your own facts. That's universal. With that said, we are looking to continue on into 2011 with a replacement. And I'm playing a role in that. I would be very, very upset if a person replaced me who was in a different place and felt a different responsibility towards you in terms of information. I can't tell you, who it is. We're not done yet, but I'm looking forward to the program being in capable hands, and the bumper sticker that change is good, so it's not really a goodbye. And my mantra has always been, doors closed, windows open. Some of the most horrible things that have happened to me in my life have always turned out to be for the best. I look back on all of them. I say, my gosh, I wouldn't be here today. I look at the time when I walked out of my surgical practice and lived on the streets. Some of those stories. Lived on the streets, almost penniless, scraping for $1. And you can imagine how my parents felt. You can imagine how I felt. But my gosh, if I didn't do that, I wouldn't be here. So it bolsters me. I don't have much fear going into the future because, life happens when you make plans. So I have no idea where I'm headed, what I'm going to do, whether I'll keep my finger in the pie or not. And I think that I can say we have hit some high points. And there are things that maybe a lot of you don't realize that this particular program has accomplished. And we really were, I think, the first syndicated radio talk show in America. And that was a milestone. Now, there always was in the past, Larry King was on a network, but not syndicated. And we therefore are probably the longest running syndicated talk show in America, way before Rush. And I was, a part of how Rush Limbaugh came to you. I'll tell you that under the heading of Life Story in a second. I had the privilege of probably in television news. Most of you have seen me on television at one time or another. Probably other than Joe Carcione. Remember him, the greengrocer? I miss that guy. Probably the most successful television syndication in news. My news reports were seen in every market in this country at one point. I'm probably the first doctor ever to get a daily network television show, like Dr. Oz does today, or The Doctors. I got to do that back in 90, 91? So it's been quite a ride. But unpredictable. You just never can predict these things. And for me, it really all started with a woman getting off a bus. And I'm not a believer in this idea that that something is meant to be, that your life is planned. I know some of you believe that, but in my particular life, I think it's egocentric to think that. Because everything that happened to me started with a woman getting off a bus, and she got off at the right time. If her kid didn't keep her awake all night long, and the pediatrician wasn't late calling her, she would have gotten off a bus at a different time, and my whole life would have been different. So therefore, the pediatrician and the kid's virus and all these things in her life were involved in mine. And her pediatrician having to have a practice near where she... So you see how it works? If you think it's all meant to happen, then you're seeing the world as everybody's dancing around because of you. So I think it's about serendipity and right place, right time, and being able to take advantage of it. But as you know, I left clinical medicine. I trained, did some general surgery, and wound up in a surgical subspecialty, and dropped out in 1972 and hit the road and did all the things I thought I wanted to do. A lot of you know some of this part of it. I tried making it as an artist, what I thought I always wanted to do. I had an antique store. I ran an antique auction gallery. I taught preschool. I worked in Project Head Start, dealing with kids. Homesteaded property in the country. Lived on the road for a long, long time in a vehicle. Just, I look back now, what a crazy thing. And then I wound up, I had a little antique store. I was living in a truck in the back with a wife, a kid, a dog, and opened up a little antique and custom jewelry shop. And a woman got off a bus. I would have been closed for lunch, but her schedule was changed, as I told you. And she walks in, and we struck up a conversation. I said I had a medical license. She was a nurse. She was a nurse at essentially what we call today the drunk tank in Sacramento. She said, we need doctors badly. Most doctors don't want to come down there. We pay $50 a day. $50 a day, of course, was a fortune to me in that particular period of my life. I went down there and I met a guy who refuses to take credit for everything that's happened since. And he worked as a night manager in the drunk tank, and we'd have these conversations at night. And he said to me, you explain things differently than other doctors do. Well, of course, I've been out of medicine for 7 years. I had to relearn speaking English, and his name was Mike McFarland. And recently I just dug him up and found him and thanked him again. He said, I got a friend of a friend of a friend who was a radio station. Would it be a really cool idea for people to call up and ask medical questions? And I laughed, of course, as anybody would laugh at such a ridiculous suggestion. And 2 days later, he was physically knocking at my house, my home. As I said, I had this antique and custom jewelry shop, and dragged me to meet a woman named Bernice Slater. She's passed away a while ago. And she owned a country music station in Sacramento. She thought it was a hell of an idea. Put me on the air for 4 or 5 shows. Scariest thing I ever did. And they sold the station. And that was that. And then comes a big leap. She sent some tapes off to a man named Mickey Luckoff, who ran one of the great radio stations in America, KGO San Francisco. And I went in to talk to him, and he had a veterinarian on the air who talked too much about dog poop, and he thought maybe better have a doctor talk about people poop. I must have shocked him. And he tried it out. 2 very, very gutsy people in the business. Put something like me on the air, never been in front of a microphone in my life. Did some shows for KGO. That was on a weekend. And then we went into weekdays. And then I got a spot on an ABC radio, was doing a syndication project, attempting to syndicate talk radio. They were in like 65 cities. And another man stepped into my life named Ed McLaughlin. Some of the previous 2 people, Mickey and Ed, are legends in the radio business. Most of you wouldn't know that probably. And Ed called me one day and said, I got good news and bad news. Bad news is you're going to be fired tomorrow. The good news is you and I are going into business. And he and I attempted to syndicate a radio talk show. We were successful, got out into 400 and something cities, and that was the first time something everybody said you could not do. You can't syndicate a talk radio program. Talk radio was only local. So then he comes to me one day and says, hey, there's this guy in Sacramento. I think we should syndicate him. I said, I don't know if I can do this. I'm just a doctor. Let's just keep our deal going. And, of course, that was Rush Limbaugh. And Rush has acknowledged this. And, of course, it's really funny sitting at that crossroads and thinking that all that's happened in talk radio, mostly, of course, because of Rush Limbaugh, that I played a role in that. And since then, of course, television happened, and here we are at the present. And there's a lot of people to talk about and a lot of people to thank that I've been involved with, and we will do so in the next few shows, and we can continue talking about this if you'd like. For this particular program, if you've got thoughts or feelings, it's hard to say goodbye. It's extremely difficult for me, and it has been quite a ride. And I feel privileged to have had this experience. It's the greatest learning experience of my life. I've learned more from all of you than in 10 medical school educations, because that's what it's really about, isn't it? All right? So, as I said, we can do regular stuff, or if you want to talk about these changes, I'll answer questions as honestly as I can. I've always told you the truth, and will continue to do so. All right, I'm Dr. Dean Edell. The phone number here, 1-800-548-TALK, 1-800-548-8255.